Migraine headaches, how to treat and prevent them. Part 3B, lifestyle changes and devices. Hi again, everybody. In our last installment, Part 3A, we discussed all of the medications used to prevent migraines from occurring. In Part 3B, we will focus in on the non-drug methods used for migraines, discussing lifestyle changes and the new neuromodulation devices used to treat and prevent migraines. There is no cure for migraine headaches, but patients can take an active role in managing them, maybe reducing how often they get them and possibly controlling how severe they are by following some changes in their lifestyle. Lifestyle changes, which we all should follow, are especially important for patients with migraines to adhere to. Get enough sleep. Not getting enough sleep can trigger a migraine. Aim for 7 to 8 hours of rest each night. Establish regular sleep hours. Go to bed at the same time each night. Eat at regular intervals. Don't skip meals. Eat regularly scheduled meals. Drink plenty of water and apply healthier eating habits. Exercise regularly. Regular moderate exercise will release chemicals that block pain signals to the brain. Physical activity will also help to reduce anxiety, stress, and depression. Exercise is a good way to help maintain a healthy weight. And identify and avoid food triggers. Migraine food triggers include MSG, monosodium glutamate, aspartame, nitrates in cured meats like hot dogs, artificial sweeteners, and alcohol, especially wine. Caffeine products such as tea, coffee, or chocolate, or a lack of caffeine called caffeine withdrawal. Here are some relaxation techniques that patients might want to try. Managing stress and maintaining a calm state. Biofeedback, meditation, yoga, relaxation training, and mindful breathing. Temperature therapy. Applying a hot or cold compress or washcloth to the forehead or neck. Ice packs can have a numbing effect, which may dull the pain. Resting in a dark, quiet, cool room. Light and sound can make migraine pain worse. Relaxing in a dark, quiet room, napping or resting with eyes closed. Some other relaxation techniques include massaging the scalp, applying pressure to the temples in a circular motion. Caffeine, sipping a caffeinated drink. Small amounts of caffeine may help relieve migraine pain symptoms in the early stages. Other relaxation techniques include acupuncture, aromatherapy, cognitive behavioral therapy, and drinking lots of fluids, especially if the migraine is accompanied by vomiting. Now we'll move on and talk about the neuromodulation devices used for migraines. Neuromodulation devices are non-invasive, non-drug ways to help prevent, reduce, and stop migraine attacks. These devices provide an electrical current or a magnetic field to stimulate the central or peripheral nervous system. All of these devices can terminate acute attacks that are already underway. Most can be used to prevent attacks. Indication. Neuromodulation devices are typically used for patients who prefer non-pharmacologic treatments or who have an inadequate response, inability to tolerate, or contraindications to drug treatments for migraine. They can also be useful for patients suffering from medication overuse headaches. Availability. Currently, there are 5 FDA-approved neuromodulation devices for migraine: Cephally, Relivion, Savidual, GammaCore, and Nerivio. These devices are expensive, and most aren't covered by health insurance. Side effects. The side effects of nerve stimulation are usually mild, such as redness or skin irritation, skin numbness, and muscle twitching in the area where the device is applied. Some patients have reported feeling lightheaded or having a tingling sensation after treatment. Contraindications. There are situations in which nerve stimulation cannot be used. People with epilepsy or implanted electrical devices like cardiac pacemakers or implanted hearing aids should not use these devices. None of the devices have been evaluated for use in pregnant or breastfeeding patients. And people who have metallic implants in the head or neck should not use them. The first device we will talk about is Cephally. The Cephally Dual External ETNS, External Trigeminal Nerve Stimulation device, is the first neuromodulation device that received FDA approval. The device is designed to be worn on the forehead. It delivers a mild electrical stimulation to the supraorbital nerves above the eyebrows. These microimpulses stimulate the supraorbital nerve, targeting a branch of the trigeminal nerve and a common location for migraine pain. This stimulation eventually desensitizes this nerve over time. The device can be used once daily for 20 minutes to prevent attacks, and for up to 60 minutes during a migraine attack to relieve symptoms. Cephally is the only neuromodulation device that is currently available over the counter. The other four require a doctor's prescription. The list price is $400 to $470, and replacement electrode pads cost about $25 to $40 per month. Insurance does not cover it. Relivion. Relivion is another ETNS device that delivers pulses of electrical current to stimulate both the trigeminal and occipital nerves. The device is a non-invasive headset that wraps around the head to deliver electrical pulses to both the trigeminal nerve in the forehead and the occipital nerve in the back of the head. The device can be connected to the Relivion smartphone app. The initial fee for the trial program is $150. After that, the device can be purchased for $650. Add $15 to $35 per month for electrodes. It is not covered under insurance. Savvy Dual. The Savvy Dual, made by eNeura, is a single-pulse transcranial magnetic stimulation device, STMS. It delivers occipital nerve stimulation, ONS, targeting nerves on the back of the scalp. The handheld battery-powered magnetic device is held firmly against the back of the neck, cradling the base of the skull. The device delivers a brief, single magnetic pulse that interrupts abnormal electrical activity in the brain associated with migraines. The Savvy Dual is the only device on the list to use magnetic stimulation instead of electrical stimulation. The device can transmit a patient's treatment history to a cloud-based diary. Cost is $350 to $400 per month, which includes acute treatments and preventive treatments. Some insurance companies cover it. GammaCore. GammaCore is a non-invasive vagus nerve stimulator, NVNS, that targets the vagus nerve, which travels from the base of the skull to the abdomen. The patient applies gel to the handheld device, places it on the side of the neck, either side of the neck will work, then turns on the device. It is programmed in cycles to electrically stimulate the vagus nerve for 2 minutes. The device was cleared by the FDA for acute treatment of episodic cluster headache attacks, as well as for acute and preventive treatment of migraine. The initial cost is $455, then $200 a month. Most insurance doesn't cover it. The final device that we're going to talk about is the Neurivio. Neurivio uses remote electrical neuromodulation, or REN. This treatment works on the concept that stimulating nerves in one part of the body will short-circuit the pain response in another part. The device works by stimulating peripheral nerves in the upper arm. Stimulation of these pain fibers sends messages to the pain control centers in the brainstem, which blocks the pain signals from reaching the brain. A wireless remote-controlled cuff is wrapped around the upper arm, applying an electrical pulse to the nerves there. The device is controlled by an app on a smartphone. The list price for Neurivio is $600 for each device. Each device is good for 18 treatments, and then it must be discarded. Insurance coverage can reduce the device cost to $49 for an initial 18 treatments. Refill devices are $89 each. Here's the table comparing the 5 FDA-approved devices. The targeted nerve is different for each device. The trigeminal for cephaly, trigeminal and occipital for Relivion, occipital for Savidual, vagus for gammaCore, and peripheral for the Neurivio. The Savidual is the only device that uses a magnetic field, while the others are electrical currents. The only device that can be currently purchased without a prescription is the cephaly. All others require a doctor's prescription. All of the devices are indicated for acute and preventive uses, except for Relivion, which is acute only. 3 devices can be used in adolescents: the Savidual, gammaCore, and Neurivio. Summary. In Part 3B, we listed 4 key non-drug lifestyle changes that can be implemented to prevent migraines. We described 6 types of relaxation techniques that can be used to prevent migraines. And we compared and contrasted the 5 FDA-approved neuromodulation devices used for acute treatment of migraines with respect to current used, nerves targeted, prescription status, and age. We've got a lot in store at the PharmEasy Tutor channel. There will be upcoming talks on shingles vaccine, RSV vaccine for adults, electrolyte management, atrial fibrillation treatment, and drug overdose, and much, much more. So please stay tuned to us. Thanks for tuning in to watch this installment of the PharmEasy Tutor. I hope you learned something that you could use at school or in practice. If you would like to continue to see more of these types of tutorials on YouTube, please make sure to click on the black subscribe button below to change it to the word subscribed. Also, if you like this video, I would appreciate it if you can click on the thumbs up icon below to change the color to black. Also, if you have any comments or questions, please feel free to add them in the comments section below or share this site with someone else. Stay tuned to the PharmEasy Tutor channel for more lectures in the upcoming weeks. So until next time, remember to take it easy.